Okay, my name is John Smith. I'm the director of Butte Health Center at Western Illinois University. My typical work day can be as mundane as reviewing or writing policies, and as exciting or challenging as dealing with a student that's suffering from a mental health crisis, and everything in between that. A lot of meetings. It's really probably the most interesting job that I've ever had, in that it's always something different. I may have a plan and a schedule for the day, and before 10 o'clock that's out the window and I'm off doing something else. Well, for those of you that might like to go into the healthcare field and be the director of a college health center, the first qualification is a master's degree in a health-related field. Most positions that I've looked at or that are out there require a minimum of 5 years of experience in a college health field. It also requires that you have supervisory experience, experience with budgets, experience in health, and knowing a lot of the issues that college students may encounter with college health. And it can range from homesickness the first week of school, so you need to understand the difference between homesickness and depression or anxiety, and you get to know the students in that regard. I just say a general overall knowledge of how a college university runs, the types of things students encounter and often find challenging. They'll come in under the guise of it being a medical issue, when in fact I would say probably 40 to 50% can be addressed. The anxiety, because they haven't attended class for a week, can develop into a severe stomach ache, and they really don't need care or medicine, they just need someone to talk to, and our providers and nurses are really good at that and have gotten adept at it. And as the director of the health center, you need to know those things so that you can educate the new people that come onto your staff. So those are the basic qualifications that you need. Some schools will be more specific and want different qualifications, but here at Western, that's what you need to get a job as a director. I think the best part of being a health center director is getting to work with students, getting to know them, both as patients and as employees. We often hire grad students, we have interns, we have student workers, and getting to know them and what they want to do in the healthcare field, educating them on what courses to take, what it will take to make them successful. And in doing that, we get our doctors involved, we get our nurse practitioners involved, our nurses, our pharmacists, because we employ students across a broad range of topics. I think currently at any given time I'm probably mentoring 4 students that can be from psychology to health services management, on how to be a good leader, how to motivate staff, how to provide the best care possible for students. And when I'm doing that, that's the best part of the job. The flip side of that is the worst part of the job. And that's when you have to deal with students in crisis, students that may call and are thinking about self-harm or harming someone else. And we have an emergency consultation team on campus that gets involved in cases like that, and that can consume a day, sometimes more than a day, in trying to help a student sort out a crisis and get them in a place where they can get back to school, get back to their studies, and go on and have a successful academic career. I really don't like to have many of those days, but on average it's probably at least once a week we have a student in crisis, and that worst day can become the best day if you're successful in helping them overcome those obstacles. I think the advice I would give students that want to go into the healthcare field, especially psych majors, is really pay attention in the courses that you're taking, courses that revolve around personality, understanding behaviorism is really important in being a successful leader in a college health center, or probably any management style job that you'll want to go into. Also, I think it's something that's helped me a lot is the stats courses that I took as an undergraduate and graduate student, as well as the research methods. We're always looking at data and developing ways to implement better healthcare for students, and knowing how to set that up and how to interpret the data that we collect is really important, and I think that's what makes us successful at providing the best healthcare for students. Now, for employees, earlier I mentioned personality and behaviorism courses. Understanding what motivates an employee is really important in helping put them in a position that will make them successful, versus putting them in a position that may cause them to be disgruntled and not enjoy what they're doing. Being able to evaluate that and help put them in places for success. I got a lot of information and a lot of my ideas now on how I manage from those courses. I would also encourage students, just in general, to get involved in the campus community. We have a student health advisory committee for people that want to go into a healthcare field, and they advise the staff at VUE on things that we need to do differently. We also have a students talk group on campus that go out on campus and give lectures and presentations on safe drinking. A big range of topics that are student driven, that you see on campus that you think need to be addressed, and we help you develop and polish those. So as a student, take advantage of all the resources on campus, not just in your department, but throughout campus. Get a hold of student activities. They're really, really good.